How an occupational therapy assess Guillian-Barre syndrome, and how to set the goals, and how to intervene the person by using the occupational therapy. Myself Sukumiii, I am the student of occupational therapy. We already discussed what is Guillian-Barre syndrome. It is an autoimmune disease. Our own immune system affects the nerves of the peripheral nerves. So PNS is getting affected by our own immune. So in I button you can click the video and watch. In assessment section we can the person level of function. So in which level the person is functioning. So what are going to be improved. So assessment results giving the idea to the therapist to make goals. For assessment we can use some skills or by observing. So not observation of the therapist is same as the observation of the another therapist, but scales are same for all therapists. So we discuss only about the scales. First scale, functional independence measure. So FIM scale used to measure the functional status of the individual. These assessments include 18 areas. So the person is dependent or independent is measured here. So independence in self-care, sphincter control, mobility, locomotion, communication, social cognition, etc. I will provide free FIM scale PDF in description of the video. Click the description and download it. So the scoring or rating has 7 levels from 0 to 7. In 0, activity did not occur even dependently. In 7, activity can occur independently. So these are the borders. So in 1, the person dependently do the activity. In 2, he requires maximum assistance. In 3, he requires moderate assistance. In 4, he requires minimal assistance. In 5, he requires supervision. So one should supervise his activity to do. In 6, he requires modified dependence, or he can independently work with a modified way. In 7, he can do the activity independently. So this is a scale used for the FIM. For GPS person, we can use the FIM scale. Then huge scale. It is maximum used by the medical and to assessing the health status of the person. So by this scale, the therapist can assess the recovery progress of the patient and setting goals very easily. So this scale is rated as 0 to 6. So 0 is healthy person, 6 is person is dead. So rate is between the 0 and 6. So 1, the person having minor symptom and the person capable to run also. In 2, the person can walk without assistance for 10 meters or more also. In 3, the person need assistance to walk 10 meters. In 4, the person may be bedridden or chairbound, which means the person is in wheelchair also. 5th score, the person want ventilation. So the person want assisted ventilation for part of the day or all the day. In 6th, the person going to dead. The scale can also be used by the doctors also. Then for GBS person, we can use motor assessment scale, MAS. This scale is designed to measure the motor recovery. So the person having the peripheral nervous injury. So the muscles of the peripheral system may be weakened. So the person how to recover in motor region. So recover in motor area. To assess this scale is used. What are all assessed here? The person can able to change his lying position from supine to side lying and supine and sitting at the side of the bed. So from supine to sitting with the side of the bed. The abilities are measured. In balanced sitting, the person can able to sit in a balanced way. Then sitting to standing. Then the person can able to walk or not. So that also measured. Then upper arm movements, hand functions. So here we don't call it as hand function. We have to use hand movements. So hand movements. Then some hand activities. So these motor assessment are assessed here. This also have a scale rate. So 7 points are there for this scale. Then for GBS we have to use manual muscle test. So we are going to assess the strength of the muscle or power of the muscle. So in each group we can use the MMT individually. So for flexor, for extensor, so that like. So we are going to relate with the gravity. So in response to the gravity, we can change the position of the person. It also having rate from 0 to 5. So 0 is no contraction and 5 is normal power. So the person can contract his muscle with maximum resistance. So by using this, we can assess the muscle strength of the GBS person. Then pinch test. Pinch test, we assess the lateral pinch, hip to pinch of the person. So What is pinch is a hand function. So by using thumb and other fingers, we can pinch like this, tip to tip and pulp to pulp. So lateral pinch are available. So for the syndrome patient, we can assess these areas. Then we can use the role checklist and the occupational questionnaire. Role checklist. It is used to assess the client how perceiving the role and how participating in role in present, in past and future also. So it helps to identify which role are significant to the client. So client may think this role is significant to me. So by using the role checklist, we can identify that role. So and he have a perception to the role. So this role is this like that like perception he have. So how he changes his perception from role to role is also assessed here. By this we can use his natural motivation to engage in task. Then occupational questionnaire. So it is used to assess the personal value over the occupation. So the client have some value on occupation. So that value is assessed here, and what are all the daily occupation of the client also assessed here. So normally 4 questions I consider this activity to going to be a leisure or work or recreation, or it is very important in my daily living. Question example: reading is my leisure or recreation or my work. So that like question is asked first. Then I will do this very well, poor, very poor or average. That question is second. Then for me this activity is very important, less important, no important. That like question. Then last question: how much you enjoy doing this activity? So while doing the activity, the person how much he enjoying. So he is liking it very much or strongly dislike it or neither like nor dislike. That like we have to make the goals. So in initial phase we have less time. So occupational therapy involvement is very less. So in initial phase we don't do any goals. So after the person getting the disability, we are going to make the goals. So I already said by assessment we can use the scales and tests to measure the level of functioning of the individual. By the level of functioning of the individual, we can make the goals. In plateau phase, the person have no maximum functioning. So after recovery phase, the person may have more functioning. So in plateau phase, the person having minimal functioning in their life. In this phase, the person may have many more weakness in their muscles. So with weakness, the person can able to perform their daily activities with minimal resistance. Then we can use adaptation and modification and some strategies to make the person to perform in their occupation also. So it increases the productivity of the person and it also increases the recovery of the person. So we have to make the goals according to the person. So if they have low energy, then energy conservation. So these are all used. And in psychological side also we have to make the goals. Some person having anxiety or some person having phobia or some person having depression in this GBS. So we have to focus on these psychological areas also. So simply we can focus on the areas of occupation, then performance skill. So the person range of motion and muscle strength, maintaining proper positioning of the person while sitting, standing or lying in the bed also. And we have to use the CBT. So we have to change the thinking of the person if the person having any psychological issues. Note that person having severe symptoms require assisted devices like splint. So the person having severe symptoms, then the person may have low productivity. If the person having mild symptoms, then we can increase the productivity of the person using strategies, and this may help the person to recover from the disease. So main goal of the productivity is to make the person involving with the safety and effective way in home or work also. Then intervention. Not all the person have needed same intervention. Some needed some areas, some needed another some areas, some needed both and more areas also. So occupational therapists can use these ideas in your intervention. So and the intervention should be client centered. So what are the need of the client should be fulfilled in your intervention. First we have to focus on self-care. We can call it as ADL, activities of daily living. First, bathing. The person can able to bath in sitting or in standing. Standing is in the person having minimal symptoms, then the person can stand. Problem in performing some activities means we have to assist them to perform this while bathing, and we have to use modifications. So we have to modify the activity in a better way so the person can able to do. So it also providing success to complete the activity. Then suffering. So the person can transfer from the wheelchair or walker to the shower chair. So for this, the person requires only minimal assistance. So we can modify in this area also. We can use grab bars and non-slip grips and removable shower head. So by this modification, we can improve the independence of the person in performing the activity. Then bowel and bladder management. Some persons may catheterized in the beginning of the treatment. So as occupational therapist, we have to develop a bathroom schedule. So and using the timers. If the person having no bowel movement, no regular bowel movement, then we can recommend digital stimulation, which are stimulating the bowel activity. So that like adaptive technique we have to use to solve the bowel and bladder management. Then dressing. The person having low range of motion, having trouble in dressing also. So as an occupational therapist, we have to educate the person to use modifications. So how the person can be able to dress in a modified way. We can recommend dressing stick, button hook, shoe horn, elastic shoelaces, and we can assist in dressing. Then eating. So the person having muscle weakness in mouth also. So that affect their normal eating. So we have to increase muscle strength in mouth by practicing movements. So what are the movement? Tongue movement. So and make the patient move his mouth in a different ways. So we can introduce a bolus bag that improves the chewing of the person. We should recommend a thickened liquids and softened foods so that the person can prevent the aspiration. So if the person having GBS, they have chances to aspire. So which means the food can go into the windpipe also. So to prevent this, we have to recommend some things. So if the person having the speech therapist, so having taking therapy in the speech also, we have to collaborate with them also. Then feeding, the person having low muscle strength and coordination, so they have problem in self feeding. So we have to set the meal time and we can recommend the adaptive eating utensils. Use spoon. So the person having low range of motion can use long handled spoons. So by this we can solve the problems in feeding. Then functional mobility. So the person having reduced muscle strength. So the person can't able to transfer from bed to wheelchair and can't able to stand, can't able to walk. So that like mobility problem are shown in the CBS percent. Various transferring methods and modified transferings, and we can use sliding board transfer or two-person transfer, one-person transfer. We can also assist them to use their adaptive devices. So wheelchair, how to use the walker. So we have to teach them. So if they want some modification, so we can also modify the wheelchair, modify the walker, or modify what are the adaptive devices used by them. We can modify. So in this area, physiotherapist also involved. In personal devices care, the person may use the specs or hearing aids. So if they have the muscle weakness, so we have to assist in maintaining the personal devices. So how to care the personal devices are instructed to them. So we can also modify how to care, and we have to focus on the areas personal hygiene, toilet hygiene also. Then we have to focus on the person having decreased energy, decreased muscle strength. So the person can't able to carrying the others. So we have to improve the muscle strength and their energy level. We have to conserve the energy to make the person to care of others. Then communication management. So if the person can't able to communicate in one way, we can modify the way of communication. So if the person having speech difficulty, so speech pathologists also get involved in this. So we have to work in the areas to make the person communication to meet their needs. So if they want to do something, so it's their need, then we have to make the person communicate to fulfill their need. We can recommend adaptive writing utensils or computers or mic or voice communication. We can also recommend the modified mobile. So modified mobile with the enlarged button. So we can use the lighting techniques. So if the person want assistance, then they have to switch on the light. So then staff nurse will come. So that like assistance to communicate with the staffs also provided to the patient. Then community mobility. The person having decreased muscle strength, so the person can't able to easily make the mobility. So we can use the modified scooter. So if the person want a public transportation, then we have to schedule the correct timing, so in which the person can easily and freely move in the public transportation. So that like schedules are provided. So the person want to shift from the home to workplace, so that schedules are provided in a free time. So we can also develop a list of people who can able to assist the patient. So this person able to assist in this area, so another person assist in this area. So that like list we can use and implement practically. We have to focus on financial management and health management. Since the person having low muscle strength, so the management are also important for them. Then house management, so house establishment, cleaning, laundry, so that like activities are modified or simplified to the person. Meal preparation, if the person having interest in meal preparation, then we have to modify or make easy the person to do the meal, so very easily how the person can easily adapt. So that like we have to make the changes. Then if the person having religious interest, then the religious observance also implemented. So if the person want to see the search service, so one person going to search and make a video call, or take the person to the search and so the something. So that religious interest if the person have, then we have to make the person to attend, so it increases their motivation. So that is our goal. So we have to do this also. Safety and emergency management. So in unmodified environment, the person having many more unsafe things. So we have to talk with the person or patient guidance audience, so about the safety. So we have to guide them to maintain the safety. And in any emergency situation, the person may have any seizure. There is a neurological environment. So the person having seizure means then what they do. So that like emergency precautions or teach them. We have to teach them. Then we can engage the person in shopping, education participation, and we can enhance the person's job performance by modifying the job environment or modifying the devices. And employment interest or acquisition. So the person having interest in acquiring many more skills means we have to make the person explore it. So that also increase their motivation. Then leisure exploration. Some person may have to retire after the aging, so we have to manage their leisure time. So what are the activities can done in the leisure time? So how to make the person happy in the leisure time? Then the person wants to explore in volunteer participation. So they want in a community, so then the person want to change the community in a positive way, then we have to make the person as a volunteer, and we have to encourage them, and we have to modify environment to make the person do what they want to do in a positive way in a community. Then we have to focus on performance skill. First, range of motion. So range of motion, the person having a low muscle strength, that restrict the range of motion. The person having the possibility to develop the contracture or deformity, so we have to give passive range of motion in their lying period. So if the person is bedridden, we have to give passive range of motion also. So we can use some exercise to make the person active. Then muscle strength. So in recovery phase, muscle strength is very important. So the person lose their muscle strength almost. So we have to recover the muscle strength by giving the muscle strengthening activities. So we can grade the activities from non-resistive to resistive activities. Initially non-resistive activities, then resistive activities. Then we have to focus on the coordination. So the person should integrate the two sides of the body equally. So bilateral integration. And we have to focus on the coordination, eye hand coordination and two hand coordination, bilateral coordination all. Then most important area, energy conservation. The person having low muscle strength and decreased activity level, we have to conserve their energy. So we can use simple techniques. Example, sitting during grooming and sitting in household activities. So high energy consuming activities should be done first. Then low energy activities. So in first they do, we have to prioritize the activities. So high energy activities are prioritized first, or the most interest activity of the person is prioritized first. Then the person can easily use the energy in their interest way and in the prioritized way. Then we have to focus on the sensation. So due to the nerve involvement, the person may have chances in sensory issues. So the person can't able to recognize the temperature or two-point discrimination, stereognosis, classification. That like sensory issues may happen in that person. So we can use sensory integration techniques to intervene the person. Then pain. The person having the GBS may experience pain. So we have to use distraction strategies and relaxation techniques to get relief from the pain. So if we make the person to engage in the activity and make them enjoyable, then the person may have chance to distract from the pain and they don't feel pain. Then psychosocial area. In this we have to focus on rest, sleep and social participation. Rest. The person having issues like hallucination or worries due to the GPS. So we have to use relaxation techniques to avoid the hallucination or worries. So by this we can reduce the difficulty in resting of the person. Sleep. We can modify the room. So we have to modify the room to make the person sleep easily. So in some areas we can sleep easily. In some areas we can't sleep at any most. So that is the environment. So we have to change the room that make the person easily sleepable. So the person may have worries or pain or any other disruption. So we have to make the person sleep. So the sleep can improve the symptoms, pain and worries also. So we have to teach the family members to make the person sleep also. So during sleep don't talk. So that like family instructions will be given to the family members. Then we have to involve the person in a social participation, in community, in family, in friend, with friend or peer. We have to provide a environment to make the person participate. So that reduces the stress and anxiety and depression and make the person psychologically stable and psychologically healthy. Okay. In our video, we have discussed some interventions. So not only this, we have to use many more strategies and many more new ideas to intervene the person. This is one point of view. You can use many eyes and make the many point of views and create the ideas. Thanks for watching. Be proud to watch our video. In our next videos, we have to discuss more topics, more conditions individually. So if you want all the conditions like this, please join our membership. Thanks for watching. Bye.